So peptides are exciting. They're just one of the most exciting things in medicine that I've seen in quite a while. And they are poorly understood. I mean, they are, out there and people are excited about, but we really have to learn the biology behind it to really understand what they do and what's best for each person.
Hello, everyone. Welcome to Bathroom Diaries, where we explore the science, psychology, and culture of aging well. Today's conversation sits at the intersection of medicine, beauty, and modern bioinnovation. Peptides have become one of the most talked about tools in wellness and longevity, praised for their potential to support metabolism, skin health, recovery, and even cellular aging. But in a world where trends move faster than evidence, it's important to ask smarter questions. What do peptides actually do? Who should be using them and who shouldn't? And how do they fit into a responsible, whole body approach to longevity? To explore this intelligently, I'm joined by Dr. Rob Frankel, an emergency physician, anti aging specialist, and the host of Modern Man podcast. Together, we'll look past the buzz and into the biology, examining where peptide therapy shows promise, where caution is essential, and how innovation can coexist with medical integrity. Let's begin. Hello, Dr. Franco.
Hello, Dr. Jan. It's wonderful to hear from you and see you and be on your podcast.
Thank you. I'm so grateful that this is happening, and you have been my mentor for like over a decade now. So I thought, who best to speak to than you, and to figure out all these new advancements.
Well, you've been a great colleague to me, and I appreciate all the time that we've spent. Usually, our conversations, are 5-minute conversations that end up to be 2 hours, and we integrate a lot of things into our practices because of our conversations together. So, as much as I've been a mentor to you, I feel the same as to about you as well.
Oh, thank you. That's so nice.
Yeah, it's true.
So tell me what's going on with this new thing on the block. I mean, we do know GLP. Everybody has heard about GLPs, and they're like one of my favorite peptides, but there are so many more, and people are always like throwing these strange names, and all of them have like this distinct like name, which is a half alphabetical, half
Yeah.
numerical, and it can be very confusing, and which ones are FDA approved, which are not. Please make it make sense.
Yeah, sure. So, I mean, peptides are, are basically short chain amino acids. So, proteins, just for like argument, for biology's sake, are longer chain amino acids. So, the amino acids are kind of like the building blocks of proteins. So, peptides themselves are kind of shorter chain amino acids. They're not quite proteins, but they're not as short as amino acids. But what they do for a lot of cases is they signal the body to do certain things. And this is what is really exciting about them because of the fact that what we're trying to do, as opposed to kind of work and kind of stop, certain biological processes, we want to enhance the things that are going to be most helpful to our bodies. And so every patient's different, and that's really the one important thing that I kind of bring to it, that I think that it's important that we don't just kind of haphazardly say, well, this is great for this, so I want this. Every patient's different, and we both know that, and every patient is going to benefit from certain things, and then for other things it might not be the best thing for them. So peptides are exciting. They're just one of the most exciting things in medicine that I've seen in quite a while, and they are poorly understood. I mean, they are, out there and people are excited about, but we really have to learn the biology behind it to really understand what they do and what's best for each person.
So is it like some kind of like a text message. So it's not like, somebody was saying that, peptide is like, it is like a text message to a cell or to an organ that you are inserting in your system. And it's going to carry a message that then the cell will carry out.
Yeah, I think that's
Instructions.
correct. Yeah, I think that's a good way to put it. It is kind of a signal for the body to do certain things, certain biological processes. And so, for that, it's in a lot of ways better than, even, certain types of, therapies, medications, because a lot of times the medications are going to bring a sledgehammer to whatever biological process you're doing. Whereas the peptides, what they're doing is they are enhancing the effect that you want. And so, like the perfect type of peptide that we talk about are the GLPs, which I think are game changing in a lot of ways. And I also appreciate the magnitude of what they've done for the health of a lot of patients in our community. And what they do is they're giving a signal for the body to kind of regulate their insulin, and in that, the effect of it is going to help people lose weight, people not overeat, and people kind of eat the things that they are supposed to eat, and leans them out in a great way. So I think that that's a good way to put it, that there are kind of signals and they're not kind of the sledgehammer that a lot of times medication does to certain biological organs.
Wow, okay. Yeah, no, that makes sense. So tell me more, say there which peptide is for what thing,
Sure.
if that is like, so for longevity, is there a different one? And then what is for, like, I have like a friend of mine whose son just recently texted me some
Mhm.
of these names just to find out, and he's an adolescent, and he
Right.
was like, should I take this BP, that BPC or some other?
Mhm.
And I was initially like very hesitant to say, please go and take something. I was like, no, first you improve your lifestyle and, modify your life in a way where your body can create that miracle by itself. But then I've also heard that there are like these in Korea and in some other places, people are already taking this, which is making them like super tall. And like everybody, like one of my friends, she went to Korea and she was like, everybody's tall. So, like, why are they so tall? Are they taking like some peptides, or what is it that they're doing? And many of them are not FDA approved yet.
Right.
So it makes it like there is this gray area of like, if there is a possibility of becoming taller or altering your genetic code in a positive way, like enhancing your, I guess, not altering, but enhancing your genetic code in a positive way, I would be all for it. But how do you discern? And are there any specific ones that I need to really know, some names that I need to like really learn?
Sure, absolutely. I'll go through some of them. Some of the stuff that you're talking about is very important, because it is true that much of the peptides that we're going to be talking about are not FDA approved. They have not been fully tested. They have been tested a lot on animals. There has been animal studies. Some European studies have been out there on humans. Tesamorelin, which is the one that you have on the screen now, what they went through a very extensive test with HIV patients. Now, HIV patients develop kind of visceral fat, with their treatment, with their disease. And what they found is that when they put patients on tesamorelin, this targeted their visceral fat and organ fat. So that patients who have a fatty liver, for instance, they have an increased risk of inflammatory disease, hypertension, diabetes. For
Mm-hmm.
those patients that we see, there is specific evidence on these studies that were done, and I think it was done in Harvard, with these HIV patients, that it showed that they had a very significant amount of decrease in visceral fat. And, for our patients, that of course is important. But I mean, a lot of times in our aesthetic business, people want to know, well, how's it going to do for me? But what tesamorelin does is, and I've had patients on it who have like lost their kind of belly fat, completely just being on it. But again, it's what tesamorelin is it's a growth hormone releasing hormone agonist. So what that means is that it increases the production of growth hormone. Now, people get very nervous about it, and obviously, like we said, people who the certain patients, should not be taking it. People or cancer patients who, have a high risk of cancer. Growth hormone, of course, is going to increase the production of cells. Now, the difference between taking growth hormone and something like tesamorelin is the text message, like you were saying. It tells the body to produce more of it, but it doesn't actually give you the hormone. So your body will kind of have that regulation. It's normal auto regulation to stop it from overproducing it, which is really kind of the major thing that we talk about. So tesamorelin is one of those hormones that peptides that do have some FDA work on. CJC, which is another peptide that you're showing on the screen, also a growth hormone releasing hormone agonist, also with a lot of positive results in longevity, cognition, and and just anti-aging itself. This is a little different. They started doing human studies on it. They have not completed all the studies on it. So there's definitely some research that's out there. But again, for our patients that I see that I'm working with, we do blood work. We check them out to make sure that they are right candidates for these peptides, and that's the most important thing. I could go on about probably one of the biggest peptides out there, BPC-157, which is called is basically one of the body protective peptides. So what that does is that has a large amount. It's actually starts in the stomach. It's a gastric peptide, but so it does actually help patients who have gastritis, other type of GI issues. But what it really does is it helps with inflammation. And this is one of the biggest things. I have patients who have just had surgery. One patient who recently had knee surgery was struggling, not getting around, having trouble getting around. Put her on the BPC 157 with the TB, which is also another great anti-inflammatory. And what it did for her is it really helped her with her rehabilitation. So patients who have had injuries, people who have joint pains, people who have things that are just trouble getting them around and not able to function at their best, this peptide really was a game changer. I mean, for a lot of patients that I worked with. And it's definitely one of the more popular ones out there. But in a lot of ways, it really is a positive one. I could tell you like personal stories. Now, you know that I'm an ER doctor, right, Dr. Ben?
Yes, of course, of course.
So what I could tell you is that in the last I've gotten a little older in my days since we've hung together for almost.
You've only anti-aged as far as I'm concerned. You're the remember when we did Altherapy practice
Uh-huh.
together. That was like when I was purchasing my first unit of Altherapy.
Right.
I have one quick question in this. When you mentioned that you do blood works before you start any of these, or when you monitor something, is there anything particular that you are testing, or just like regular?
I mean, mostly basic labs. I always, look at, kind of the overall, things like cortisol, vitamin D, but also specifically if we're thinking about doing anything that's going to increase growth hormone production, we'll do insulin growth factor, which is kind of like the measure of growth hormone. You cannot measure growth hormone on its own specifically, but insulin growth factor is a good measure to tell you, is this something that is, that's elevated in our system? Is it deficient in our system? So that's one of the big ones, but also, A1C, all the metabolic inflammatory markers, ESR, CRP. I mean, all the things that we look at for, is there overall inflammation in the body? Is this body healthy or not? And that's really, I think, is the most important thing metabolically, is what I'm looking for. But what I was saying about being an ER doctor is for the last, I'd say about 6 months, and like I said, we've known each other for quite a long time, but the last 6 months, I've been doing procedures, like central lines, intubation, things like that take a lot of dexterity. And over the last 6 months, I was having a little trouble with my dexterity, just kind of like doing fine movements.
Mm.
Since I started taking, there's one specific peptide, and it's called BDNF. So this
Mm.
specific one actually claims, and obviously, from what it says is that it does increase the neural pathways in our brain, in our body. So I was taking this for the last 2 months, and I could tell you, and this is, of course, anecdotal, but I could just tell you from my own experience that my ability to do fine movements and dexterity have improved dramatically since I was
Nice.
taking it. So, I mean, that's just my own personal story.
Is this a pill or is
This
this
is
a
also
shot?
injection. This is also injection.
It's
BDNF.
okay. It's a shot.
And there are things that you could take. There's something called Cmax, which is a similar peptide that increases the production of BDNF, which, like I said, increases the neural pathways. And we all want to have that kind of movement where we're able to like recall things like we used to when we're in our 20s and 30s. And like sometimes things don't come to us. And, I do find that it has improved since the fact that like I've been taking that specific peptide. So that one is a really fun one for me personally.
Okay.
But
Like a
BPC,
signal enhancement.
yes,
It's
correct.
like when you get like a very solid Wi-Fi signal.
Yes, exactly,
And
exactly.
things just start moving fast. It's like a fast, it's an enhancer of a neural signal.
Yeah.
So wow. How do you dose these things? Like for
So the dosing is kind of patient specific, So like again, that's one of the things that, again, because of the fact that, it's not FDA approved, I think that as practitioners, we need to be very specific for our patients. And I think that in a lot of ways, patients are, taking whatever they're hearing on TikTok.
yeah.
Just as with your experience with the patient's son, my son himself is an athlete, and he kind of comes to me and says, "Dad, can you tell me, like, can we get this? Can we get that?" Because they're watching on TikTok all these different things, and they're getting these peptides from who knows where. And that's really kind of the one thing that most worries me, because of the fact that in a lot of ways we don't know the purity of where peptides come from in certain places, and you really have to go through a practitioner to be able to know that you're getting real peptides, know that you're getting dosing that's going to be appropriate for your patient, and of course, depending on what they really are needing, this is really another thing that we really kind of have to go through, for each patient. It really is kind of patient specific, and because of the fact that we're kind of taking the ball and saying that these things are helping patients, with that, we need to be the responsible ones in telling them this is the dosing that you should be taking for your specific issue.
Yeah. Okay. Yeah, no, I get it. So it's somebody who is trained in these should be monitoring it. It's not oral. Are there any peptides that are available in a pill form
There
that
are,
somebody can get it over the counter or something?
there are. So you have to be concerned about certain ones that are, like broken down in the system, like NAD, for instance.
Yeah.
NAD. If you go through, or my favorite Krebs cycle with I'm learning again with my daughter who's in PA. Um,
Nice, nice.
but I mean,
Congratulations.
so
Thanks.
with like NAD, for instance, it is an important peptide, because what it does is every part of the cellular respiration has to do with NAD being appropriately in the system. And so if you are deficient in NAD, a lot of the aches and pains, the fatigue, I can't just, do the things that I normally do anymore. I go to the store and now I'm exhausted. I need a nap. Those types of things are have a lot to do with our ability to be able to normally cellular respirate. So NAD is really important. However, NAD is out there orally. And the problem is that if you learn anything about biology, it has to be broken down in environment that's alkaline. And so it actually gets into your stomach, breaks down the system. The peptide is broken down completely, and probably very little to almost none will actually get into your system. And so for something like that, it's going to be useless. I mean, there are certain peptides that are oral that do have some efficacy, but they're the best. I think the best kind of delivery method is either sub-Q, IM, depending upon the peptide.
I have a question about NAD, and one of the things that I tell my patients is, and who seek this NAD, which is like, to me, I feel that NAD is a booster.
Right.
If intravenous infusion and nutrients and stuff, if we equate that with, like, let's say an oil change in a car, the NAD is like a booster. And I say to my followers that, please, before you put a booster in your system, make sure that your system doesn't have any cancer cells,
Right.
because body does produce cancer cells, and they do tend to accumulate sometimes. And when you boost, the booster doesn't care it's a normal cell or a cancer cell, it's going to boost everything. And so, how do you, and definitely I don't support NAD orally, because I'm like, what's the point if all of it gets denatured in your stomach?
Right.
And that's the same concept behind the intravenous supplements also, that, the supplements that get destroyed in your gut, just bypass the gut altogether and place them in your system so that, you get the actual benefit that you intended to. I totally understand that, but how often do you recommend NAD, or do you like just?
Well, I mean, I think that NAD, like you said, the concern for, like any type of, cancer cells and things like that are something that you need to, talk to your patients about. And this is what a good history is. Good history, physical, discussion, sometimes not even the blood work does, but a lot of times, learning the patient's family history, learning, what their risks are, their age, whatever else they've been exposed to is really important. So knowing your patient is absolutely the number one thing that you need to do, because you're right, because cancer cells actually are more bioactive. So they will suck up energy quicker than normal cells. And so if they find something that is going to give them energy, they will take it, before our regular cells will. So what I'd say is that, with NAD, I mean, there is definitely protocols for it. And it really is, I usually put patients on like 6-month cycles of NAD, whether it's sub-Q or IV, because I think that it really is something that, you can fill the tank, like you said, and you could let the body kind of do its thing. And I think that, over a 6-month cycle, you could take, depending upon whether you're doing IV or sub-Q. If you're doing the sub-Q, you could do 100 twice a week, or, once to twice a week, depending on the patient. Again, you have to look at the patient's size, the patient's, the amount of kilograms that you're working with, and also their overall health, because of the fact that certain patients are going to be healthier than others, and they might need the same, dosing as a patient who, does not, who is in less better health. And so I think that it really kind of is depending on, but usually 6-month cycles of NAD, I think is a good kind of like benchmark to work with, like weekly or, biweekly, depending upon each patient.
Nice. And I also wanted to go over, like, so I don't know if we've talked about all the, what are the peptides before I mean, I know I'm gonna keep asking you about safety questions for
Oh,
this, because that's why people would come to us, is like,
yeah.
those who want to experience longevity without creating unnecessary problems.
Right.
But what are the ones that peptides? Did you find any that were so?
So
You mentioned cognition.
I'm gonna bring you one right in your right on the screen. This is one of my
Nice.
favorite ones, especially for the aesthetic business. So this is a glow peptide. What this has in it is GHK copper, plus has the BPC and the TB 500. And so what this peptide does, because of the fact that learning the anatomy of how collagen is produced, one of the things that we lose in our system is enough copper. And so with this peptide, what we found is that patients have improved their collagen, skin tone and texture, as well as we've been injecting it into hair follicles as well, because aesthetically it's one of the go-to peptides, absolutely, for patients, because with the BPC and the TB, they're decreasing the inflammation, that often cause like scarring and lines and wrinkles. But with the GHK copper, the copper helps the collagen and elastin to bind, and so you produce more elastin collagen internally, as opposed to, with all the great procedures that you do, Dr. Din. This is giving the extra boost that your system needs to help kind of use the cells that we have, produce new cells, and then do the things like the laser therapy and all the other things that you do that really are going to help like make it into like one great package. So this is my favorite. This is one of my favorites. GHK.
I can't wait until now that you have cleared it for me, I'm definitely going to try it. I always like to say that anti-aging is a dish that can't be created with just one ingredient. And this is like a longevity is a dish that we serve, which has several ingredients, several elements that as many of those you have to do at home by yourself. And for some, you have to come to a doctor and do, these things also. So this seems like extra spices and extra ingredients that we're just going to add to make it more delicious and more palatable and more, impacting. So you feel that the results will last longer can it enhance, will it enhance the filler, hyaluronic acid filler and Botox results in a way where it may last longer, or is it just like a glow up one?
Well, I mean, I think that, for the most part, everything that we do, and I talk, obviously, that I do aesthetic medicine as well. And so like,
Yeah, the best. The first time I got my lip done was, I think the second one, like your first or second one, you did it. So, I have to
and
come back. I have to
yes,
do
you
my
can
jawline.
always come back. But so, like what I tell patients when we're treating them aesthetically is that, what we're trying to achieve in any type of procedure that we do is we're trying to get the body to produce more collagen, produce more elastin, because these are the things that as we age start to become diminished. So the procedures that we do that in a way by causing an organized injury, right? Whether it be
Mhm.
microneedling, whether it be like I said, Ulthera, laser, all these things, they cause an organized injury where the body has to do something. But if you can find a way to make the collagen even more healthy and stronger, then of course the collagen that's going to be produced is going to be one that's going to be better. So I think that long lasting, these will have positive effects. And even, like I said, without the aesthetic procedures alone, I do see results with patients that feel like their skin is like improving. They feel like their lines, their wrinkles. I have some patients that have acne that have taken the glow, that have done great with it, and actually have decreased their acne production and their acne scarring. So it's definitely a fun one for
Oh,
aesthetic
that's
medicine for sure. This is like an absolute necessity. This peptide.
how much does it cost? I mean, I know that there is a slide where we are also, we are going to go over the cost, but like, just for this, let's say, oh yeah, it's right there.
Yeah.
So what is like, so because all of these are medications that promote health and wellness, so it's not going to be covered by your insurance, and
Yeah.
these are out of pocket costs. Beauty is an out of pocket cost for sure. So um, what is the approximate cost that people need to know, because these are now new ingredients and new elements that you're going to give to your body so it can produce new miracles for you. So What is the cost when appropriated correctly?
But my answer, of course, is what's it worth to you to be healthier, clean? No, but
It's
of course,
it's invaluable.
yeah, like in reality, it all, again, I mean, I hate going back to this. It all depends on the, like what the patient's needs are. Yes, I would say like this is a good range, 250 to 600 per month is probably a good range, for overall kind of like peptides. And again, like the last slide, I didn't really kind of get into, but as far as the dosing, the cycling also is also important, that you're not going to be on these peptides forever. Like a lot of times we'll cycle patients on and off for 2 months. We'll take them off for a few months. We might recycle them back on. It really kind of depends on what we're trying to achieve. And you're not going to be on the same peptide for an entire year, for 10 years, for 20 years. It's going to be kind of like a process where we're really kind of trying to get the best results for each patient and the most long lasting results without like actually making them have to take peptides every day. Now, I personally think that it's worthwhile. It's a worthwhile cost for your health, for your aesthetic beauty, because at the end of the day, I mean, these are the things that really kind of make us, more healthy. I feel like the things that we do a lot of times are helping, for our beauty, our health. But I think that overall, what we want to do is we want to become a more healthy, person, and that really kind of helps, decrease the cost of medications, doctor's visits,
Yeah.
hospitalization. So, I mean, that's really what is the cost of, like being healthy and not having to, be sick, not being
Yeah.
out of hospital, not being able to work because you're, have, some disease, not having, so I mean, I guess it's, 200 to 600 range is probably a reasonable like estimation, but for everybody,
Mhm.
it's, I would say.
It's different. Is it something like when we do, for instance, Botox?
Yeah.
It is every 3 or 4 months. Is there something like that with these peptides also? For instance, the one that you're talking with the copper, is that like a monthly? Like how do you tell your patients to, like, how often do you come, or do you pair it with any other treatment? Like especially the one for skin, let's say.
Yeah. So the copper peptides, like
Lucy, can you move it? Yeah.
we'll cycle people, probably 6 weeks on and then like a couple months off, usually with the copper peptide. So
More.
yeah, so for the GHK, the glow. Um,
Mhm.
and so that really, but depending, so some patients, there's a lot of evidence, and there are some research, like human trials with GHK copper for hair, because of course, anything that can grow hair is something that's going to be, is going to be tested and seen. And there has been really some good evidence for it. So depending upon what the needs are, there might be more intensive treatment with it. But I mean, for the most part, yes, you could cycle on, peptides for a month, maybe a month or a month and a half, then go off it for a few months. For like the Tesamorelin, which is the growth hormone peptide, and the copper, the Tesamorelin, which is the slide before. If you go down
Yeah.
one, that's the one that is FDA approved. So,
Yeah.
so this has a lot to do with, again, lean body, but also, because of the fact that the one thing that it was tested on in FDA is the fact that, was the kind of visceral fat, kind of lean muscle, kind of like losing that belly fat. But the one thing about it is that for patients, that are looking for kind of strength, energy, this is a great peptide, but also it actually helps patients sleep better. And this is one of the things that I find patients have some of the most problems with as they get older, is having like a good full night's sleep, which, I think we're going to talk about later. That sleep is really kind of one of the most important health factors that people don't think about. As doctors, we don't do that enough. and,
Yeah.
but
Got it.
but I mean, I think that it's one of the most regenerating factors that, patients who are on tesamorelin, there are peptides. There's another peptide called DSIP, which is something else that's great for sleep. Another peptide that's out there, which is really interesting, called C-Lank. Now, this is actually for sleep, but also helps with anxiety. So for patients who are on, it's a GABA, it's a GABA agonist. So it actually helps you relax a little bit more, helps you kind of like get out of your head a little bit. So there's a lot of incredible, like potential for each of these peptides. But again, they need to be done for the patient specific and also for the patient that it's done, like.
Are you saying that there will be a time where peptides will make the new way to do medicine and health, where every person as a concierge will be able to say, okay, here's my blood work, these are my problems, and make me my own peptide?
Well, I mean, I can't, I'm not going to like say I'm going to
Next one.
the future, but, I've been screaming about the fact that, the food pyramid is an upside down for almost 20 years. And finally, somebody agreed with me in government.
Yeah.
So,
Thank
anyway,
God. Thank
so,
God for that.
yeah. Yes, I mean it's been my kind of like little, my little, pilgrimage, in medicine to say that what they're saying is actually making people more sick and unhealthy. And
Yeah.
finally, we have somebody who actually agrees with me in government. So you never know. I mean, I think that there's definitely the people who know and people who have you kind of recognize peptides, are understanding this, and that understanding that there is a better way. The side effects are definitely less, problematic than, a lot of the medication side effects, because they're not deranging some of the physiological effects of that our bodies are doing. They're kind of promoting certain more positive effects, and that's what I think is
Um,
the most important, like, point of it. That it's not actually kind of like I said before, taking a sledgehammer to our biological processes. They're actually enhancing and making them, improve the things that we want to improve. So.
yeah. Um, Wow, that's incredible what you're saying that and so what are the common side effects? What are the
Uh,
common side effects
So I
that
mean, like with
this one? Yeah.
every peptide, there are certain side effects. I mean, we can go over the GLPs, right? Which
Yeah.
obviously we all know that there were side effects with it. Um, but you know, it could be nausea, could be, vomiting. There could be more significant, side effects with the GLPs. Some of the side effects, some people have kind of lightheaded dizziness, things like that, with certain of the peptides. For the most part, there there's there's not a lot of kind of, significant, side effects. But again, you have to think about what the peptides are doing, and for
Hmm.
that matter, you have to think about like what are the possible like long-term effects. And so this is what you have to kind of use in your head and say, like, well, if this is doing this for our body, then how is this going to ultimately affect it? Or are there going to be negative effects? And so that, as a practitioner, we have to kind of look at, like you said, talking about the cancer cells, things like that. We need to be aware of that, and we need to be, we need to be like the kind of gatekeepers to kind of say, like, this is good for our patients, or this may not be good for certain people. So.
Yeah. Do you give these medications to your patients to be able to take it at home, or can you like for instance GLP-1 agonists, people are injecting themselves, and yes, many of them are over injecting themselves,
Right.
they're overdosing, and I see all the time, like, they just increase it. It's like I sometimes feel that like just like for Botox, you won't just give it to somebody to inject themselves. Should we give these medications to people and tell them to just measure it themselves?
Well, I mean, I think that to a certain degree, like, I mean, I think like the GLPs, I kind of watch over my patients with the GLPs because I think that you want them, that they can have significant side effects, so you need to kind of be wary of that. So I'll see the patients, weekly, but some of these peptides, the reality is that you cannot see patients every day, and some of these peptides do best at dosing that is kind of daily. So
Yeah.
it's kind of like, you're just not going to be able to, like get the best effects without, them dosing it themselves. And I'm very kind of careful in describing what the patients. A lot of times, what I will do is I'll mix the dose. I'll show them the dose that they need to take every day. I'll, put it in a syringe for them and say, this is the
Mm-hmm.
number that you need to go to every day.
Mm-hmm.
Sometimes I would even, for certain patients, which I think would be better, is I'll dose it in the syringes for them and send it home with them. So it really kind of depends on the patient, how, like medically astute they are, whether I feel like they can do the wrong thing. The one thing that I would say not to do is to, buy these online without knowing who's selling it to them. And so there's a lot of, like I said, Canadian suppliers, other suppliers that I think is really kind of like the dangerous part, because again, with anything else, you just don't know what's coming in, what you're putting into your body, and that itself, with the like the name on the peptide without knowing, that there's somebody responsible behind it is the danger that we all worry about.
Yeah, no, that's 100%. I agree with this, that knowing where stuff is coming from is very important. Everybody who is anywhere in the world who has the resources wants to buy from United States. They want like anything that is, produced here. People want to get their hands on it. It's a shame that people in United States are want to get the cheapest thing that's getting made in some, third world country, and they don't know if there what safety standards are there, or what monitoring is there. So it's, I guess, just the lack of resources. And also, I think at some point, not just the lack of resources, but also the prices and the knowledge. It's like these are not tomatoes that you're getting from, a different country. This is a medication that can alter your inner biology. So definitely, I agree with that. That it should be best uh, done as you're doing, like you prepare the shots, like the GLP ones will, where I will give to patients. I would make their shots, and I'll say, okay, these are shots for the next 1 or 2 months, and then, I know at least that they'll come back and do it again. And I'll get to see them, and, just control with like phone calls, like what is your weight, how are you feeling, what's going on. Rocio, can
Right,
you
and I
keep
think that
moving the
that's
shot? We have to go through all of these slides, so I just want to make sure that we have not
yeah, of course.
forgot, so who are the ones who so this is the slide about who should totally avoid it.
Yeah. So, I mean, I think that, this kind of lays it out. This slide's a good
Mhm.
slide because it definitely patients who, have a cancer diagnosis or are at a very high risk for potential cancer, or patients that you never want to do anything that's going to potentially make the problem worse. Our goal is always to improve patients and not, make any problems worse. So that's one. Pregnancy, of course, this is something that absolutely is another thing that you don't want to do anything that's going to affect development, fetus development or anything like that. So that
Mhm.
is another one. Patients who, have autoimmune instability. I mean, these are a lot of times these are patients who are, like inflammatory. So it depends upon the patient. because sometimes, these patients can benefit from some anti-inflammatory, but you don't want to throw everything at them. You want to make sure that whatever you're targeting is going to be something that's going to be beneficial for them. Hormonal chaos, this is another kind of how I would, characterize like autoimmune instability, is that you want to, make sure that whatever you're doing for these patients are going to benefit them and not create more problems where they are. And then obviously the shortcut mentality, people who are just want a quick fix on everything. This is, these peptides, you can't take them one peptide one day and think that you're get the golden ticket of health. You need to actually, just like everything else, whether it's working out, eating right, doing the things that are going to be beneficial, they take time, they take energy, they take work, they take your kind of like participation. And so this is another part of, the fact that patients who think that this is going to be their golden ticket to health, they need to work for it too. So there's a part of it, besides for doing the peptides, they need to change their lives as well, meaning like they need to exercise, they need to eat right, they need to do the things that are going to benefit them. So you can't, for these type of patients, that just want that, like quick fix, that limitless drug. Have you ever seen that movie, Sophia?
Which one?
Limitless, where the guy took a pill and then he got 90% of his brain function in a day.
I
So,
saw its trailer and it's on my list of watch, so I'm gonna go and
yeah.
watch it for sure. But this list is making me want to ask this one very important question, which I can't miss, is that are there any peptides that you recommend for perimenopause and menopause, or andropause? um,
Yeah.
that should be taken in, and that's going to be my next podcast with you on hormonal replacement therapy, because you're one of those people that I know who has been doing it the longest before it became a thing. But I wanted to know that while we're on the topic of peptides, are there any peptides that you recommend for people who are experiencing a pause in their existence?
I mean, I think that for, like for, hormonal problems, there is kind of like a natural balance between being able to, work with the hormones themselves, as well as, taking the effects of hormonal deficiency as well. So I would say like something like a growth hormone agonists are really helpful, because a lot of the things that, women and men deal with on a regular basis have to do with, their deficiency in hormones, such as kind of gaining kind of abdominal fat, having decreased cognition, kind of brain fog. So, that, another peptide which I kind of advocate for, with NAD itself, is MOTC, which is another kind of mitochondrial peptide. So what this does is this is going to help kind of your energy level, your overall, like function, as well as your metabolism, breaking down fat. I mean, one of the major things that, I find and I talk to patients about with hormonal changes is that the one thing that changes in our body when we when we lose our hormones is that our hormones are deficient, and so one of the major things is to be able to kind of replace the hormones in an efficient and safe way that's going to help the patients, because I think that in that way that's most important. But also all the negative effects that go along with us losing our hormones, the things like, growth hormone, things like C-Lank, which I talked about earlier, which helps with anxiety. So the negative effects of hormonal deficiency are often improved by using these peptide agonists to help, as well. So there's not like a specific hormone that is going to help boost testosterone to a level that is going to help, a patient get back to where it should be. The same thing with progesterone in women, the level of deficiency for that occurring. You're not going to take a specific peptide, although HCG, which we've used, both of us, you've used in the past,
Yes.
weight loss, is an agonist to luteinizing hormone. So it does actually produce more progesterone and more testosterone in testosterone in men, progesterone in women. And so, I mean, this is one of those peptides that is effective at producing, like our body letting it produce it. So, I mean, it really is depending upon the patient, but I think that kind of optimizing the hormones is really going to be the thing that's going to help the most. And then using our peptides to help to fix some of the negative effects of losing our hormones are going to be, efficient in that. So, but there's not one
So,
peptide that I could say like this is going to increase your testosterone so you don't have to take testosterone, or this is going to increase your progesterone so you don't have to take progesterone. There's not a single peptide that I would say that does that to a level that is going to be enough for our patients to get to their, like most optimal level, and that's what we're trying to achieve.
so would you say that somebody who is on HRT and is still experiencing some shifts and that pause, that sluggish, that metabolic sluggishness or sleep issues are not improving, they need to consider some of these peptides, adding these peptides on a regular basis or cycle through them?
Definitely. I mean,
I
I do think that, yes, I think that as an adjunct for a lot of the negative effects, it's going to help because, with hormonal health, it really is kind of like I always talk to my patients about. It's sort of a roller coaster in the fact that your body is going to improve, and then all of a sudden you're going to need a different dose of peptides or hormones, I should say, to get to the right level because our bodies are constantly, taking these hormones in, specifically. So it is super important that if you're doing HRT, you need to do it with a practitioner like yourself that's going to be
Mhm.
able to monitor, the hormones to be able to see, what levels that you're at to be able to really get you to the where you're supposed to be. So I do think that
Um, are there any topical peptides that you also recommend, like for instance for skin or?
Yeah, I mean, I think for at right now, like they have been doing some studies with GHK, which we talked about before, the copper,
Mhm. Yeah.
using it topically. And so, the jury is out. I mean, I
Mhm.
think that for the most part, I mean, we all know that the best way to get, something into our system is through, IV or subcutaneous or intramuscular, because of
Mhm.
the fact that it's going to bypass, the normal kind of barriers that our bodies kind of are put up against it, such as the GI tract, even skin in itself, only lasts, for 28 days, so it's going to constantly slough off. So that's why if you're doing treatments without, that are more significant, like things that kind of like you do, like microneedling
Mhm. Mhm.
or anything that's deep enough that gets to the permanent layer of the skin, a lot of this stuff is just wasted money. So, I
Yes.
mean, I'm always kind of, very, very cautious to recommend anything until I see results or see, true data that's going to, say that this is going to be helpful or not. So,
That's great. Dr. Franco, I really am so grateful for you and for all your information and knowledge. It's like we do not have enough time to like go over in one sitting. So you do have to come back and do this again because there a lot of questions remained unanswered. I didn't even get to them. But
yeah.
I do want to also get some of your like handles that you would like to share with my people to see if how they can reach you for your consultation and evaluation. If you tell us, I'm gonna put it in the in our captions and in in the body of this podcast also. But is there any website or do you have a physical
I mean, if you
office?
go to like our, like our Instagram, both Vitality Wellness Club is Vitality Vitale underscore Wellness Club. That's where we're doing a lot of the research with the peptides. You can go to the Modern Man podcast, which I do, and you'll have to come on my podcast now, Sophia, for of course.
I for sure we this is great because we can, because we have been in on this path
Yeah.
for over a decade, so it's really good to align the knowledge base and experience. But definitely, I would definitely have you one more time for the HRT conversation because that still remains. But I'm gonna just end this talk with a lot of gratitude and just this last few sentences that peptides represent to me a fascinating shift in modern medicine and a move towards precision, personalization, and proactive care. And today's conversation reminds us that innovation works best when it's guided by evidence, ethics, and a deep respect for body's complexity. And longevity isn't about chasing trends, it's about building resilience. And beauty at every stage of life is rooted in how well we function and not just how we look. Until, if you've enjoyed this episode, please share it with someone who cares about aging intelligently, and please follow Bathroom Diaries for more conversations that challenge, inform, and inspire. Until next time, stay curious, stay grounded, and stay well. I'm gonna end this part over here, but I have for your I want to do like this rapid fire questions for you
Yeah.
because that's something that is like going to be a separate skit, and we're going to
Okay.
maybe like keep it as a part of this conversation also, but we can use it for my social media thing. So my rapid fire questions. Number one, most overhyped peptide.
So for me, this is an easy answer because the most overhyped peptide I think is insulin. Insulin is a very important tool for patients who are type 1 diabetics because of the fact that they are deficient in insulin. The problem is that too many patients have gone to the point where they have become insulin insensitive. And so we're using insulin as something that should not be, part of our system because of the fact that insulin in itself is inflammatory and it actually decreases repair. So instead of like looking to insulin as helping these people, we should be looking at diet, exercise, and getting them on the right path, as opposed to giving them this peptide, which is actually more inflammatory and more damaging to the patient.
Oh, wow. I didn't expect that answer, but that's a good one. And maybe it needs another podcast on that. Number two, most underrated peptide.
I mean, I guess it's hard to answer, but I would, like I said, like since we're both in the aesthetic field, I think the glow peptide is probably the peptide that's going to do the most, for our patients, and it also has a lot of, like positive effects, for wellness and inflammation too. So I'll pick the glow, which is GHK, BPC, and the TB 500.
Wow, I'm getting this today. Um, Biggest misconception about peptides.
I think that the biggest misconception is that it's just another, like fad. And I do think that for the most part, people are kind of curious about what it is that we're working with. And these have been around for quite a long time. And like I think that the most life-changing peptides, are the GLPs that came out recently. I think that for so many patients, it's helped their health, it's helped their, weight, it's helped their inflammation. It's something that has been life changing, and I think that it puts a kind of picture on like what the peptides can do and what our bodies can do if they're just led in the right direction.
I 100% agree with that. I couldn't agree more. Um, One red flag you always watch for.
I mean, I think that again, I think it's important that we need to be good practitioners, that we need to look at our patients individually about everything, which I feel like is the most important. And if we find that things that are potentially going to be damaging to our patients, that we need to kind of be the ones that are the gatekeepers, and the people who go out and do stuff on their own have to be really cautious about that, because of the fact that they don't really know what's in their bodies. They don't know what this can do to their bodies without the help of a knowledgeable practitioner. And getting materials from who knows where is obviously something that is something that we have to make sure that we avoid.
Yeah, people who do things on their own and then they'll come back with the problems. Yes, 100% agree. Peptides you avoid.
Insulin.
You be see, listen, you have your mind made up. We need another podcast on that. Do peptides slow aging or improve function?
Well, I mean, I think that obviously each peptide has different signals. They work on different parts of the body, and for the most part, there's a lot of positive effects on each one. And so it's different than taking a single drug that does a certain thing. They are enhancing certain properties of our body that we want to enhance, as opposed to highlighting things that might be not beneficial to us. They might do one thing, but they might hurt us in certain ways. So because it's targeted, it really tries to work on enhancing certain things that we need to kind of achieve. So I think that in both ways that they could be beneficial depending upon what it is working on.
So depends on what we're targeting.
Yeah.
What matters more, peptides or sleep? Or peptides for sleep?
Well, I think that both are regenerative to some degree, and there are peptides, like I said, that
Yeah.
actually help sleep. I mean, I do think that women who are lacking progesterone, and this is one of the things I get very upset about, like traditional medicine, where the OBGYNs tell patients that have hysterectomies that they don't need progesterone, drives me absolutely insane, because why would you not need something that you had your entire life? And so progesterone itself, interestingly enough, puts women into deep kind of REM sleep. When they don't have that, they wake up at 2 o'clock, 3 o'clock, they don't get into deep sleep. And I think that sleep is one of those things that are, with health, with diet, is one of those things that are really kind of not looked at enough, that really helps our health, our overall health and regeneration. So
I couldn't agree more. That's very well said. Um, can peptides replace hormones?
again, I think that to a certain degree, there's not a single peptide that I have found that does kind of get to the point where our bodies are that needs a certain amount of hormones can get there on their own. So I think that they work in conjunction, hand in hand. But I don't think that specifically. I truly believe in doing HRT for 20 years with patients. I find that their quality of life, their health, their overall well-being is improved by fixing their deficiencies that they really need in certain hormonal points. So I don't think that there's a plus minus. I do think that they can work hand in hand in fixing certain problems that hormone deficiencies produce. So I think that not necessarily.
Right, great. Which peptide is mostly marketing, and what's real medicine?
So I think that again, for the most part, I mean, there's a lot of stuff out there. Like I said, the growth hormone agonists have been out there for a long time. There's a peptide Sermorelin. Now, interestingly about Sermorelin, which is a growth hormone agonist, it actually makes you hungry and actually can make you gain a little
Yeah.
weight. So I kind of look at some of the other peptides that kind of uh, stop that effect because people don't want to kind of lean out and then gain weight at the same time. So I think that that's one of the peptides out there that a lot of people know about, that might not be as good as some of the other peptides out there. And what is health? I mean, I do think that like real medicine, starts with our own kind of ability to eat right, exercise, like take care of what we have. And I think that, we adjunct the things that are deficient in our bodies by, helping patients, fix those problems. And so I think that that is kind of like the future of medicine. Honestly, I think that, more people are understanding that. The more like knowledge that we get, the more understanding that we can't just take a pill to fix this problem. We need to have a all hands on deck approach where we're taking responsibility for our health and we're actually helping adjunct to things that are important. So
That's great. And one last question. What? Not that it is the last. I'm gonna keep asking questions offline, but with
yeah.
the last question while on recording, what should patients ask first when they go to a doctor for peptides?
So, I mean, I think that it's important that you do kind of ask the questions like, the peptide, like where are you getting the peptides, the efficacy of them, but also like what are the things that this is going to help? What are the potentials, like the negative effects of them? I think that you need to be an informed patient. I tell my patients all the time that they ask questions and, like I'm not like traditional physician in a way. I mean, obviously, I have a MD. I work in the emergency room, so I do traditional medicine. But when I sit with my patients, I'm not a traditional doctor where when they ask questions, I kind of like get like upset about it. I'm happy for them to be informed by it, and that's the one thing that you want to have, to be able to have a practitioner who's going to not only kind of educate you, because that's what doctor means, right? Teacher. And so
Mhm.
besides for that, they're going to be part of your kind of part of your journey to get to the optimal health. And I think that that's what you want to see in a practitioner that you work with. So
Yeah, no, I 100% agree over there too. Your doctor is your health coach. This
right.
is the person who you have to return to. And sometimes, yes, we usually equate doctors with managing our sicknesses, but for doctors who are in anti-aging and aesthetics and longevity, they're like health coaches, they're uh,
I mean, I
medical health coaches.
I think that, like in a lot of ways, the medical profession has gotten a bad name. And I think that we're kind of like on cutting edge of being able to kind of like reverse that and change that and actually, like be the ones that are going to help patients, kind of like get them to where they need to be. And we're not kind of like, just stuck in the dogma of kind of like this as a medicine professional, you have to do this and that. Like in the emergency room, things are much easier for me to deal with because it's like there are kind of protocols on what you do. But in real medicine, before people end up in the emergency room, you want to be the one that helps them to get their ultimate health so they don't end up there and don't end up with long-term like diseases that really affect their lives and affect their just general well-being.
Yes. Well, thank you so much, Dr. Frankel. It was a pleasure talking to you, and I hope to speak to you again, hopefully very, very soon again. And I'll see you on the other side.